Good afternoon, all. Thank you so much again for joining us today. Um, it's a very significant day today. It's World Diabetes Day, as we all know. And myself, Vaidya Dr. Piyush Juneja, welcome all of you. We again thank Maharishi Ayurveda for taking this initiative on our platform to have this session. Diabetes is growing at a very significant level these days, and India is gradually becoming the diabetic capital of the world. And in Ayurveda, there are several solutions where we can manage it very easily. We all know that Madhumeh, which we know as diabetes, is mentioned asadhya in Ayurveda. However, with certain diet and lifestyle modifications and good quality Ayurveda medicines, we have seen that it is easily manageable, and many times at initial or mid level, it is reversible as well, which we have seen in many cases. However, we are not supposed to claim anything which is not scientifically proven. But yes, we have Vaidyas and Ayurveda doctors around the country and around the world who are managing and also doing the reversal. And companies like Maharishi Ayurveda are ensuring good quality medicines as far as the raw material is concerned, as far as the end product is concerned, that whenever we are giving to the patients, we are seeing significant improvement. I remember one case where around 2.5 reduction of HbA1c, it was around 8.5, 8.6, and it comes to around 6 within 3 months with certain diet and lifestyle recommendation, which is a very good improvement, very significant improvement if you go for the international standards of reduction in HbA1c levels these days, which they are doing with the diet and lifestyle modification and other interventions which are not Ayurveda. But when we include Ayurveda interventions, Ayurveda medicines, Ayurveda therapies, and all, we have seen very good results in that. Basically, we need to understand one basic concept. I will not take much time because I know that two of our esteemed speakers, Dr. Chaudhary Umakant Sudhakar from Jalgaon and Dr. Samundeshwari, they are having excellent presentations today for this topic. And we have Dr. Rajat with us, Dr. Rajat Sharma from Maharishi, who will be moderating this session. But I just requested that due to some other schedule, let me just quickly start the session, and then gradually I will hand over the session to all the esteemed speakers today to take forward on our platform. And as many doctors have already joined and several will be joining soon, our team has started propagating about this session right now. So I request all of you to take advantage and privilege of this knowledgeable session today. One basic fundamental, I think we all need to understand as practitioners, and then I will hand over the session to Dr. Rajat for further proceeding. That in Ayurveda, we are focusing on the root cause. We all know that the impairment or the like dysfunction of beta cells leads to diabetes. That is the insulin is not getting released adequately, and our cells are not able to get the adequate glucose level due to the lack of insulin, because insulin helps the glucose which is floating in the blood to get into the cells. That is a basic fundamental which we all know. And in Ayurveda, when we are seeing how we are getting good results or better result, is the basic fundamental difference is that somehow several herbs are able to uh, kind of repair or kind of you can say enhancing the beta cell functioning. They are repairing beta cells, they are ensuring that the insulin production is getting improved or better gradually, so that the patient, the kids having diabetes, is able to have a good control on the sugar levels or on the glucose levels. That is one basic fundamental which you need to understand, or ideology, where Ayurvedic treatment is different from the other pathies treatment. Predominantly, I'm talking about allopathic here. It's not the Ayurveda principles, however. Ayurveda principles are kind of a bit different, but to understand and to give a better understanding to the patients. Basically, whenever a diabetic patient enters your clinic, the first question is how Ayurveda will be able to help us. And many times they are so much having the knowledge and so much having the information about their disease because they are living with diabetes. sometimes many Ayurveda practitioners also need to understand that we need to convey them in their language as well. So that is one aspect which we need to convey to the patients. Then when they see that improvement in the clinical as well as the laboratory investigations, they somehow then develop a confidence or a trust on Ayurveda that yes, with Ayurveda we can manage and we can take it forward. Many times we have seen the standard of care which they are taking the allopathic medicines or sometimes insulin also. If they are at a level of insulin, should not be stopped immediately. It has to be in a taper off form. It has to be gradually. We need to decrease either the oral hypoglycemics or the insulin units whenever we are doing Ayurveda intervention. Many doctors have experience of ensuring that decrease in insulin or insulin can also be taper off if they have that confidence and that experience and knowledge with Ayurveda treatment. Otherwise, at least those cases where only oral hypoglycemics or medicines are there, we can easily taper off and we can easily at least manage them with the Ayurveda medicine, which almost all the Ayurveda doctors and clinicians across the country are doing. But still, there can be scope of improvement. There can be certain learnings all may not have. So today, Dr. Samudeshwari and another speaker, sorry, I think there was another speaker, Dr. Umakant, both of them will share their experience, their knowledge with us, and we will definitely enhance that today and take it forward. Maybe we can have our internal learnings and notes so that we can improve that in our clinical practice. So, on that note, again, I call of you for giving your valuable time today to us. I will hand over the session to Dr. Rajat from Maharishi Ayurveda to proceed with the moderation of the session today and to introduce our esteemed speakers. Also, I again thank both of the speakers for taking their time and coming to our platform live. Thank you so much, and I am looking forward to have many more sessions with both of you in future as well. And I request my digital team also. We are right now live on Facebook, YouTube, LinkedIn, Twitter, and we will disseminate this to many other platforms as soon as this session will be recorded. This is being recorded as well, and it is right now live on 8 platforms. So I request Dr. Rajat to take over the session from here, and thank you, Dr. Rajat, again for joining us. Over to you. Thank you.
Thank you, Dr. Piyush, for this wonderful platform. And I welcome all the doctors from Maharshi Ayurveda to exchange the knowledge and ideas on how diabetes is is becoming a sort of an epidemic in India, and what we as Ayurvedic doctors can do about it. So today we discuss the management of type 2 diabetes and its comorbidities, and myself, Dr. Rajat Sharma, as Piyush introduced. So before I start, I would like to quote Maharishi Mahesh Yogi ji that balance is the natural state of life because the basic characteristic of fundamental element of life and pure consciousness is complete balance. We all understand ना कि बैलेंस डाइट में लाइफस्टाइल में हर चीज़ लाइफ के अप्रोच में बहुत ज़रूरी है और आज इस केस में हम डायबिटीज़ में ज़रूर इसको जो है देखेंगे कि किस तरीके से ये अटमोस्ट इम्पॉर्टेंट बन जाता है कि डाइट और लाइफस्टाइल कितना अच्छे से फॉलो करना चाहिए. So let me just discuss, diabetes and its emerging, threat. As you can see on your screen, that 7.3 percent or 69.2 million of India's adult population I'm talking about, upcoming people, India is the youngest nation, और उसमें भी अगर इतने लोग डायबिटिक हैं तो हमारी हेल्थ सिस्टम जो है या हमारी हेल्थ की अप्रोच कितनी खराब है. And then out of these, 10.3% people in India have pre-diabetes. इसका आगे हम देखेंगे कि उसके रेंज क्या है. So prevalence in India is predicted to double actually by 2030, which is just 7 to 8 years. And also at the same time, people who've been diagnosed with diabetes, as you have seen in your practice or in general also, you know that 69% of people have high blood pressure as well, and as well as at the same time high cholesterol. This also will be picking up later in the presentation. You know how these things are sort of related in insulin resistance. Basically, what is diabetes? No? So diabetes is a chronic, long-lasting health condition. that affects how our body turns the food into energy. And it's like, if the sugar remains in the bloodstream, this is very detrimental to the body. And if it is sent to the glucose, if it is sent to the cells or liver, then we have a healthy system on our hands. But when it is not able to do, we develop diabetes, and then obviously all the negative damaging effects of this. So when you have type 2 diabetes, your body is unable to bring down your blood glucose levels because simply, it doesn't respond to the insulin, and it emerges silently as per modern medicine. But in Ayurveda, we can say that we have some poor rupas like केश जो हैं वो उलझ जाएंगे जब आप when you will go and comb them, या दंत मल, जो दांतों पर मल है वो बढ़ जाएगा, या फिर चींटियां हैं वो जो यूरिन पर अट्रैक्ट होंगी. All these symptoms, yeah, in some form or the other, you can say that they come up as a poor rupa, or आपको फुला फुली जो है डेवलप डेवलप होने वाली है. फिर कुछ एनवायरमेंटल फैक्टर्स हैं, साइकोलॉजिकल फैक्टर्स. स्ट्रेस इनफैक्ट प्लेज अ वेरी वेरी इंपॉर्टेंट रोल, as we will see in the adult population in the development of type 2 diabetes. So there are several types of diabetes. Type 1, when body does not produce enough insulin. Type 2, when body produces insulin but can't use it well. And then there is gestational, which is temporary during the pregnancy. So let's talk about pre-diabetes. I mean, of lately also I've seen that generally most of the sort of population around 35 or so, they have started to fall under pre-diabetic conditions. What are these? So in that, if the fasting plasma blood glucose 100 to 125, hemoglobin A1C, which is the golden standard of measuring the blood sugar over the last 3 months, is 5.7 to 6.4%. And then there is 2 hour oral glucose tolerance test, जिसमें के 140 टू 190 के करीब जो है हमारी ग्लूकोज होती है उसमें पड़ती है. बट what increases due to that? It increases the risk of type 2 diabetes, it increases the risk of heart disease and stroke because of that. And then let's talk about what is the FVG range, fasting blood glucose, where you are sort of considered in the higher ranges of blood glucose, which is 80 to 130 mg per dl. Postprandial, which is 2 hours after meals, that is less than 180, but more than 140, then it is also coming. But most important is HbA1c. If at all, if you go beyond 5.6 and to 6.4, this is higher chance of getting diabetes. And if 6.5 or higher, this is diabetes for you. What are the signs and symptoms of diabetes? One is obviously, polyuria, frequent urination, which we call as sort of prameha in Ayurveda. Then there is polydipsia, which is excessive thirst, polyphagia, excessive hunger as well. Or बहुत सारे symptoms like, weight loss, fatigue, irritability, a little bit of numbness. If you're experiencing all these together, then there is, you understand there is diabetes. Then the risk factor of type 2 diabetes, who are likely to get it, is unhealthy lifestyle, insulin resistance, high glycemic food. If you keep putting in, or if you're overweight, or if there is oxidative stress, let's say purely because of stress or insomnia or other things like that. And then, what are the comorbid conditions apart from this? One is cardiovascular disease, another is kidney, eye damage, slow healing, hearing impairment as well, and retinopathy and blindness ultimately. So this is quite tough on the body. The high blood glucose. What does Ayurveda say? As you can see, Asya Sukham Swapna Sukham Dadini Gramyo Odak Anuprasah Payansi Nava Annapanam Budaya Kritam Cha Prame Hetu Kaf Kritam Cha Sarva. So basically, what they're trying to say here is that excessive use of sweet foods, excessive sleep, excessive consumption of curd, let's say, aquatic animal, like all of these things which are high in kapha, or even new grains. We don't usually talk about this nav annapanam. You know, this is so important. The gehu, this wheat is produced, and immediately it is made into flour and then sold off to you in a very short cycle. Earlier, people used to store grains. So, in storing those grains, the water level or the glycemic load of the gehu or the wheat used to come down. And even if you consumed wheat, it would not give you as much problem as it would give in present day time, because the life cycle is very, for the gehu, for the wheat to reach you is very short, and you're not storing it. So because of its high glycemic load, you're, bound to get higher diabetes, or even, kapha rogas, as they say. So moving on, what does Ayurveda and diabetes in general is, said about? Like, for example, they are now discovering in modern medicine, okay, there are many, many types of diabetes, whereas was already explaining it, that it is kind of 20 in number. And but we are more concerned about here is Madhumeha, which, comes under Vata Prameha. And how does it actually happen? Is that when the quality and the quantity of the pitta and kapha reduces comparison to the vata, so vata aggravates. And when vata aggravates, it pushes, or rather pulls, all the dhatus out of from the body to the urinary system. For example, the vasa, the majja, the oj, and the lasika, and then it is excreted out of through the urinary system, through urine, and hence you get diabetes, because ultimately the ojas, the life force, is also leaking out of the body. So it's so important that we always understand and back calculate from where the diet and lifestyle this disease is coming from, and then work on it. And but coming back, like we were discussing, the stress and the how stress is related to type 2 diabetes. When you look at diabetes as a process of manifesting disease in several stages, you would come back that it was the pragyaprad, it was the overuse of the rasa, bodak rasa. Okay, you, because you liked sweets, you were inactive, all those stake of intellect kind of things you were doing, you develop diabetes. Especially the initial stages, the persons develop insulin resistance, which you were, sort of discussing about in the earlier time of the presentation, that when we eat food, sugar is formed, and once sugar is formed, it enters the bloodstream. It triggers insulin to work on it. Now, insulin pushes it to either cells for it to be stored there, or in liver, or the times when you are not eating but you still require energy. So this is the ideal scenario. But if you put a lot of sugar, more insulin is produced. Cells, ultimately, what they become kind of resistance. The response of the cells lessens to insulin. This develops insulin resistance. And then what happens? Because insulin is not able to work here, the pancreas think, "Oh, I need to produce more insulin." They create more insulin, but the cells have stopped responding. And since the sugar is not going into the cells or the liver, it is circulating in the bloodstream and damaging the body. Ultimately, a person develops insulin resistance, and this happens in the earlier stages of the diabetes. So it is so important to address this. Especially why the people can educate people that, okay, if you're getting these poor rupas, or if you have this kind of lifestyle or familial predisposition to this disease, then you should be concerned about your diet and lifestyle and should correct it at a better time. And it is as a secondary consequence of this, the digestive system, liver, pancreas, they have overworked for decades, and they actually get tired. And hence, all this lesson as insulin. That's why you have to give it from outside. right? So this is how diabetes is kind of creating a problem. And then how is the stress creating a problem here? That higher cortisol levels basically and low consciousness level of a person, sort of gets together and creates this stress related diabetes. Especially people, where eating at night is particularly bad, especially for diabetics. It leads to temporary increase in insulin resistance and subsequently higher blood sugar, because cortisol, your hyperactive blood, the sugar is released more into the bloodstream. And if you're eating at night, stress is there, you're already diabetic, again, high blood sugar. And now the more important thing is that blood sugar, it can spike even higher because of your growth hormone effect, which gets secreted at 3 a.m. in the morning. So jitna late खाएंगे उतना ही और sugar बढ़ने का chance है. That's why they always say keep an early dinner, so that a little bit of sugar from the bloodstream is sort of going to your glucose or the cells. So it's very, very important. Then now comes the multimodality approach of Ayurveda here. So important, so much we can do, from all these Vedic knowledge. For example, herbal medicines are there, rasayanas, there is dietary recommendation, panchkarma accordingly for the lean pramehi or the overweight pramehi, as all the knowledgeable doctors know. And then there is transcendental meditation, which we'll talk about how it is helping in later part of the presentation. Then there are yoga asanas, so beautiful, which help. For example, Bhavan Muktasana or Gomukhasana or Bhujangasana and all. Basically, any asana which is helping toning the digestive organs and helping the excess blood sugar expenditure, which is so important. Peripheral use of that blood sugar is so important. And likewise, so coming back to herbal medicines, there are like Nisha Amalaki Yoga, as doctors might have seen. In my practice, I've seen this works wonder. Then there is Nisha Kathakadi, Kashayam, and Arogyavardi, Chandraprabhavati. Shilajit is the main, one of the best rasayanas to be used in, from, all kind of Brahmanas, as you can all know. Especially if I can quote Sushru Samhita, where they say around 1 kg of Shilajit can help cure even Ojumeha, and but it remains to be a topic of debate if it can really do that, or if some person can actually digest all that of Shilajit. But anyhow, then coming back to the herbal medicines again, for example, glucomap, where we are sort of researching this compound. Let me share with you more details here. So it's a quality product, it's proven safety, and it's clinically tested. So let's see how it is before we go on. Let me tell you the key ingredients. It's jamun, controls polyuria, karela directly decreases blood sugar, neem is there, reducing pitta and kapha, the original imbalances from where the prameha started. Then there is bilva, it helps stimulate the beta cells of pancreas to help secrete more insulin. And then there is Shilajit, as we all know, it's one of the best compounds for treating prameha or any kind of Vata prameha as well. And Arjuna is also there to reduce the cholesterol level and prevent neuropathy. So important this thing is. So now glucomab, clinically researched product. We have tested this compound in many institutes, for example, like KGMC Lucknow, of AIMS New Delhi. Both are highly reputed institutes. So the objective was to actually evaluate glucomab and to evaluate the efficacy and safety in subjects with non-insulin dependent diabetes mellitus. So here we created three groups. Group A was only glucomab. Group B was OHA, which is oral hypoglycemic agent, which was withdrawn, and then glucomab was substituted. And then the group C, where both, like usually what we are doing in recent practice as well, where OHA is also given, but at the same time the adjuvant glucomab is also given. Right. So as you can see on your screens, doctors, that in Group A, how wonderful the results were, that glucomap actually affected results in significant decrease in 25% fasting blood glucose, followed by 24% reduction in postprandial levels, and 29% reduction in HbA1c level within 9 months of therapy. And these are the people who had never had anti-diabetics. So quite good in that sense. Then coming to the next slide is the effect of glucomap on group B type of patients, which were where OHA was taken out and glucomap was started. So they were earlier put on, early diabetes with the metformin or whatever, and then it was stopped. Then glucomap was started. As you can see, the glucomap intake, it was resulting in this significant decrease. For example, 11.35% in fasting blood glucose levels and 1% in postprandial uh, glucose levels. Then the effect in the group C, where it was used as an adjuvant therapy, as you can see, it resulted in the significant decrease in 32% FVG levels and 31% in PPG and 37% in HbA1c, which is a very, very good indicator that now, as you can see on the next slide, that the percentage of patients who were showing significant improvement in diabetes symptoms. For example, polyuria. It is so difficult. The diabetic has to pee again and again. 78% of the patient responded to this problem. Then fatigue is another great common problem amongst the diabetics. So 59% of those people really responded well, and rest of the percentages there. Then, as we can see, effect of glucomap on lipid profile. So not just that it is reducing the blood glucose, but at the same time, it is affecting 25% lesser cholesterol levels and 23% triglyceride levels within the 9 months of therapy. Now, let me come back to insulin resistance again. Nobody can actually comment, okay, if you have developed insulin resistance or not. But in general, if you have a higher weight, or if you're overweight or have higher lipid profile, you're more or even less active lifestyle, then you're more likely to develop insulin resistance. Or actually, doctor can declare also that, okay, high blood glucose plus all these factors which I've listed earlier can really cause insulin resistance. So in that respect, as you can see, that glucomap actually is helping you in the initial stages of diabetes more, so that it doesn't develop into full-blown disease. For example, it is helping you reduce the blood glucose, but at the same time, it is reducing the cholesterol levels, especially the triglyceride levels, reducing the insulin resistance. And for diabetes to go full blown, then you have to put insulin from outside, which is a very 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 complicated stage of the disease. So it actually is helping you prevent that. So here you on the doctors you can really with confidence use that. Let me sum it up the glucomap for you. It consists of 25 herbs. It has been clinically tested at KGMC Lucknow and AIMS Delhi, and still many other related studies about this are going on in AIMS Delhi. It is highly effective in borderline type diabetes and type 2 diabetes. It is processed, or the whole the bhavana and all that is done in salsa radiganam, which is Brahme Hara, is also made Vishoshak. So both the things are actually acting there when you use this decoction to process the other 25 herbs. Is that it is at one place reducing your blood sugar, but at the same time the maida is reduced. Your overweight, your fat is also reduced at the same time, and it has been seen that it is long for sorry it is safe for long term therapy as well as adjuvant therapy, and does not produce any hypoglycemic state as well, which is also very very important. Next is, before summing it up, we had discussed, transcendental meditation in earlier modalities of how Marcia approaches things. One is okay, herbal medicines are there, then active lifestyle is there, but at the same time, if you practice transcendental meditation, which was told to us by His Holiness Maharshi Mahesh Yogi, that stress hormones such as cortisol, adrenaline, they aggravate insulin and glucose levels in the body. And it was seen, in a scientific study that the practice of transcendental meditation can help, especially during the initial stages, lowering the insulin resistance. Reducing these neurohormones through TM helps you balance glucose and insulin in the blood and actually normalize the whole metabolism at the very base level. So, all we are trying to say here is that we have to act before it enters into the sixth stage. As you all doctors know, the complication stage. Na? We have to arrest it third or fourth or even fifth stage, where we intervene and help control the diabetes. So this is so much from me. Thank you for your patient listening. Now I would like to introduce Dr. Umakant, who is an MD and is a scholar of Rachna Sharir, and he is the Dean of Sri Gulab Rao Devkar Ayurvedic College, Jalgaon, and Medical Superintendent of Ayush Hospital, Jalgaon, Maharashtra. Most welcome, Dr. Mukherjee. Please,
Thank you.
you know,
Thank you.
enlighten us with your knowledge and take up the session. Thank you.
Thank you. वंदे मातरम। सबसे पहले मेरे गुरुजनों को वंदन अभिवादन करता हूँ। आज जागतिक बाल दिन है, उसके साथ साथ जागतिक मधुमेह दिन भी है। सभी को मधुमेह दिन की शुभेच्छा तो नहीं दे सकता, लेकिन मधुमेह मुक्ति अभियान के लिए सभी को मैं शुभेच्छा देना चाहता हूँ, क्योंकि अपना जो मोटो है कि वर्ल्ड डायबिटिक इरेडिकेशन प्रोग्राम, जागतिक मधुमेह मुक्ति होनी चाहिए। तो आज 14 नवंबर है। 14 नवंबर इज अ वर्ल्ड डायबिटिक डे। इसको वर्ल्ड डायबिटिक्स डे क्यों कहते हैं? बिकॉज द इंटरनेशनल डायबिटिक फेडरेशन एंड वर्ल्ड हेल्थ ऑर्गेनाइजेशन क्रिएटेड वर्ल्ड डायबिटिक डे.
Hi all. I think due to some technical reasons, Dr. Umakant has lost touch with us for some moments. In the meanwhile, I would like to introduce Dr. Samudeshwari ji. She's a senior consultant with Dr. Vijay Pal's Herbs Alive Ayurveda in Chennai, and she is also production head for DHI Thousand Lights, Chennai. Dr. Samudeshwari ji, I know it's a little bit earlier for you to come in, but please do the honors for enlightening us while we wait for Dr. Umakant also. Thank you. Please, over to you, Doctor.
Good evening, good evening to all.
Are you visible?
Sorry,
Good
Doctor.
evening.
Just please hold on a moment. I think Dr. Umakant is back. So,
Okay. Thank you,
Okay,
sir.
yeah.
Yes. Today we celebrate the International Diabetics Day. Next, टुडे सबसे पहले मैं पैंक्रियास की एनाटॉमी के बारे में आपको बताना चाहता हूँ. पैंक्रियास इज अ रेट्रोपेरिटोनियल ऑर्गन. इट इज लाई
hello all. So here again, we have another technicality problems. Dr. Samudeshwari ji, please, I am again requesting you. आप continue करिए. Dr.
I think
Umakant ji, you
Dr.
can take the session a little bit later.
ओके
Yeah.
ओके ओके.
Thank you. Dr. Samudeshwari ji, over to you. Please continue.
वो कनेक्टिंग थोड़ा
Yes,
सा.
sir.
हाँ, टेक्निकल
Good
इशू था.
evening to all. That was a nice introduction by Dr. Ranjit. Sir, the Maharishi team approached me and they said, why don't you, being a regular practitioner, why don't you talk about glucomap as you have been prescribing this for many years? Is my screen seen, sir? Are
Doctor,
you able to see?
yes, we are able to see and hear you, but we don't see the presentation yet. So we are hearing you well. We hear you and see you well.
Is the screen seen?
Yes,
Able
yes.
to see the
The
screen?
screen. Yes, we are able to see. Yes, doctor. We see. We are able to see. Please continue.
Sir, able to hear me? Yeah.
Yes, doctor. Yes, doctor. Please continue. We hear you and see you well.
Am I audible to you? Yeah,
Yes,
the
you are.
approach Maharishi team approached me and they asked me to talk on glucomap. I said, glucomap? Then why not? Glucomap, I'm here to present on glucomap from prescribed factors. We all know the same way that it is given for diabetes. This has been increasing throughout the world. We all of us know that. Diabetic is we know that nearly 425 million people
Hello, Doctor. We are not able to see your
are
screen. Can you
affected
go
with
to the present
diabetic.
button and present it?
Of diabetic women, and India takes around 72 States of America with 32.2 millions. Sir, sir, am I audible here also?
Ma'am, your voice is breaking. Now we see your presentation. Yeah. Yeah, yeah. We see your presentation now. Thank you. Please go ahead.
Sir, able to hear me? Sir, able to hear me?
Yes, doctor. Yes, doctor. We are able to hear you. Please continue.
No, I also don't know. There is some signal issue or technical issue. I don't know the sound. But as we all know, diabetic is a metabolic disorder, and it is of two types: type 1 and type 2 diabetic. And type 1 is a insulin dependent, and type 2 is a non-insulin dependent. Any medicine, before giving to the prescriber, I know he has to undergo a clinical trial. Similar, this glucomap also has undergone a beautiful clinical trial. As described earlier, a 60 patient was taken and it was split into three groups. Group A had 15 cases without no drug, whereas Group B was taken as 30 cases controlled with the oral hyperglycemic agent. Group C was taken as another 15 cases with uncontrolled diabetic with oral hyperglycemic agent. All these three groups were given with MA471, whereas Group 3 alone was induced with oral hypoglycemic agent as well as NA471. In all these groups, after 2 weeks, we were able to see a drastic reduction in the blood glucose level. Out of these 60 patients, which was taken for the case study, it was observed that 28 patients were recently known to be within 5 years. And it was observed that not only the glycemic level, but also the total cholesterol and the serum cholesterol and the triglycerides also were rapidly decreasing down. And nearly 68% of the patients responded with this glucomap. What are the components of glucomap? That is very important, right? I'll just quickly run through the 25 ingredients. It's jamun, again mamajwak, jamun, neem, bhumi amla, Shuddha Shilajit, Vijayasar, Arjuna, Lodra, Shvetachandar, Gudmar, Raktachandan, Bilva, Gajapippal, Karanja, Agaru, Devadar, and Karila. All these 25 ingredients constitute the glucomap. And this glucomap comes in a packing of 500 mg tablet. I was really amazed because so for better understanding, what I did was I was just looking at what exactly the formula is all about. So I was just going through the formula based on the percentage of the ingredients, I just on for combination how it really it is helping in the patients. Then I found for a better understanding that jamun leaf and seeds are 78.9 percentage, bilber leaf and decoction is 79 plus 69 percent, sugar is 79% and karika is 50.9%. All these major four drugs plays a higher percentage in the ingredients. Secondly, I noticed that Mamajwak, Nimba, Bhumi Amla, Arjuna, and decoction, all the herbs constitute with 19.98 percentage. Surprisingly, we all know Gudmar and Vijayasar is one of the important drugs for diabetic, but here in this glucomet, the percentage was less than 2%. It was 1.95 and Vijayasar 1.53. And the other next few drugs, which was Gaja Vishwe Chandan, Rakta Chandan, etc., were less than 1%. So these four drugs plays a major role. This was a beautifully coined. So drugs. Jamun, we all know that jamun major jamun seeds consists of jambu and jamun, two substances which help into reducing sugar level in the blood. And not only the jamun fruit, the jamun seed helps in increasing the insulin production in the blood, and therefore, in turn, it helps in the diabetic patient. We all know any medicine before coming to the clinical trial, it has to undergo certain process by case study. In the experimental case study, when alloxin induced rats were given when this jamun seeds, there was a tremendous hypoglycemic effect in the rats. When parts of the jamun, say like the leaf, the seed, the fruit, all this when given, also they showed a remarkable reduction in the blood sugar level. Especially these seeds, when mixed in an aqueous media, that is mixed with water and taken, it was having a very good effect on the experimental product. Alloxin, what is alloxin? To reduce the to increase the insulin level and thereby conducting the case study. Next wonderful given here was Shuddha Shilajit. When Shuddha Shilajit was given, a steady decrease in the body weight was observed in alloxin treated rats. After 2 weeks, the Shilajit did not have any body weight loss. But when this Shilajit was introduced in the form of 50 grams, 10 grams, 100 grams, and 200 grams, there was a considerable decrease in blood glucose levels. This effect of Shilajit is all we all know it is a catch-all. And this sugar Shilajit has given wonderful results in the blood glucose level. Next, we all know that is Bilba. Bilba is nothing but it stimulates the pancreas and helps reduce production of insulin, and therefore it controls the sugar level in the blood. And Bilba, we all know that it is a tree of Lord Shiva. It not only helps in the sugar, it also helps in cholesterol. It is rich in antioxidant. It is a cardioprotective as well as reduces the risk factor of heart diseases. Karela. We know the fourth ingredient, what I was mentioning, was Karela. Karela, we all know that even from our old traditional days, even our great grandfathers, great grandmothers used to say, when you are non diabetic, immediately they will ask you to take Karela powder or Karela juice. So they will, in that way, Karela works wonderful in diabetic patients in different forms. Now coming to Mamajwak. I was surprised what is this Mamajak. It is nothing but because taken the signs and symptoms of the diabetic patient and they've given a beautiful study based on the 84th day result. You can see certain ingredients like the baseline symptoms like Avil Mutra, which was 26% as a baseline. After the 84th day, it has to 6.7, and Trishna, which was 50.8, as reduced to 17.4, and Hastapada Svedam, which was 44.4, as reduced. And apart from that, it also has a very good effect on HbA1c. And there are some chief complaints in diabetics. In that, the very common is excessive hunger and excessive thirst. In this, you can see that is 45.2 as a baseline, as considered some excess thirst, which was 45.8 as baseline, as to 10.8, and which was nearly 71.3% has come down to 13.6%. So the has a role in reducing this blood sugar levels. Now we all talk on properties, but all this about the glucomat. But basically, in my practice, I have been seeing mostly a lot of people complaining about fasting from sugar. I don't eat much at the night, but still I could see lot of sugar in the morning fasting bloods. And either I need to increase my night dosage, or I need to either cut down food whatever I have to take in the night. Usually, what happens is that fasting sugar is usually high in the nights. Around a diabetic patient, around 8:30, they try to take empty happens and the sugar is released into the blood. After 8 hours, say typically after 7 hours later, immediately the glycogen process, you all know what happens. The brain cells gives the signals to the liver to develop the glycogen, and then goes into the bloodstream. That's why the morning blood sugar is usually higher in diabetic patients. So what you need to do is better don't ask them to alter the medicine or neither reduce their intake of food. Make sure they add more of fiber content food can take a longer period to get dissolved in the body, and so that the sugar is not being visible. I have seen in my practice that lot of people have when they come from the allopathy system or other systems, they bring a prescription. It's all based on the calories. But I think Ayurveda doesn't go with calories. It is based on your Agni, based on your digestive fire. So when a patient comes with a doctor to advise on their Agni, what kind of food is usually uh, is really good for them and not based on the calories. And if your Agni is strong enough to digest so many materials, then you can accordingly plan for each and everyone. And there is no fixed diet chart for any diabetic patient, as every individual is different and everybody's lifestyle is different. There is totally, you have to see the patient, base it on one-on-one, and then give a proper diet chart and ask them to take the food. That way, based on their lifestyle activities, only you can plan. There is no any fixed calories or fixed diet chart for any common. As a common, there is nothing there. And some people's usual doubt is, doctor, can I take some straw it will aggravate your kapha. So kapha in turn, you know that it is a basic disaster for diabetics. So it is always better to take a seasonal salad or raw salads. And next one, I would like to give all these as a tips for the practicing doctors. That's what I'm trying to do here. A lot of people I could see idli is a very common stable diet for any patient, diabetic patient. They'll say, yeah, you can take 2 idlis. Idli is being highlighted more. So urad dal or the masha which is in the idli is not good for digestion. It is very difficult to digest, and hence when the kapha increase, again we know diabetic cannot be brought into control. And I have seen in my
Doctor, doctor, we'll have to
that is
request
why
you to
this
come back a
weekend
bit
I am on
earlier.
Saturday off, so I do the grinding of the batter and use it.
Dr. Chandran, we would want to request you
Am
that
I
you have to
audible?
your voice is
Think
breaking
so?
also. Yes, your voice is breaking, and we have to conclude a little bit
Am I
earlier.
audible?
If I request you, please, I conclude it earlier. Thank you. Thank you.
Okay. So this batter is really because the this batter which is kept in the fridge is really not good for the patient digest, because after see the freshly grinded batter which is fermented immersed is really good and it's easy to digest also. Whereas when kept in the fridge and taken as and when and used, it is undergoing three different temperatures. One which is kept in the fridge to the room temperature, and then it goes to the process that is third temperature. And all these three, when taken together, it is not an healthy diet. And in turn, this can also lead to not only diabetic, other major diseases it can lead. Usually there is one more question. Most of them ask us whether I can take, what rice I can take. The best rice you can take is red rice, brown rice, or barley. All these are the options. And next, coming to, instead of taking more of liquids, it is better to take as a full form, like the barley or the wheat which has to be cooked, and it can be given taken to the patient, where you can add a lot of veggies so that fiber is more in that, and it can take longer time for the patient to get converted into glucose, because usually diabetic patients feel the hunger very often. So if they take a very light food or like soups or something, the food gets digested very quickly and they feel the hunger very often. So you can mix more of fiber foods or like this barley food with it, so that it will take longer time for it to get digested and converted into sugar. And in that way, the blood sugar can be better managed. And now we all know youngsters when are, sir, is it audible? Yeah, nowadays we know that a lot of people, when they come to Ayurveda, either they would have seen some other system of medicines and they directly come with a puppy blood and they ask you to treat. My sincere advice is just going through the fasting and PP sugar. Don't confirm it as a diabetic. Rather, you can go for a HbA1c or other insulin resistant test. Make sure that they are diabetic and then start your prescription. And apart from this, we all know that the major three things we should not do. We should not eat when we are not hungry. And according to Ayurveda, we all know overeating, undereating, or improper eating is dangerous. And then they are advised any diabetic has to go at least 30 minutes of exercise. And nowadays everybody is within the four walls doing a laptop only, work from home and everything, continuously busy on the laptop. There is absolutely no movement at all. So at least make sure at least 30 minutes of exercise
Thank you,
the
doctor. Thank you. Thank you. I think we are running
glucomap
out of
I
time
have
here.
given to lot patients, given to patients either as a single drug therapy, and wonderful results have been ask them to come every month and 3 months once periodically we maintain a HbA1c. In that given only with glucomap, and there was wonderful results. And in some patients I have given a combination of glucomap with other medicines also, and even in that there was a good results. And thirdly, even in instance where the patient doesn't want to take insulin, they come to us and ask, doctor, it's been quite many years I've been taking insulin shots, it's enough, can I switch over to this system medicines? Yes, of course, but immediately we are not supposed to stop the insulin units. Gradually, in the course of time, we can taper the insulin shots and we can slowly use this medicines. In that cases also, along with some rasa preparations, we had also given this glucomap, and there have been wonderful results. And the patients, there are certain patients where they have even stopped some insulin shot for some time, and it is always essential to make sure they have a track of their diabetic levels periodically, even though if they stop the other system of medicines, and even if they are in your ayurvedic, in our ayurvedic medicines, it is mandatory to keep and by following all these simple protocols, definitely we can reverse it. Being a diabetic, day or no, we want a diabetic free world, and to keep us healthy, because diabetic itself is not going to cause major damage, but diabetic can lead to major damages in our body. So let us all eat healthy and stay healthy. Thank you for giving this wonderful opportunity by Maharishi.
Thank you, Dr. Sumandeshwari. That was very lovely session from you, hearing about all the Shilajit and other compounds in detail. And now I would like to request again to Dr. Umakanji, please continue
Thank
your
you, sir.
wonderful.
Hello. Good evening to you, everyone. Skin is visible. Screen is visible, all of you.
Yes, yes, doctor. Please go on.
Yes,
We
sir.
are
Okay, okay,
seeing
okay,
this.
okay, 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 sir.
Doctor, can you do the full screen or zoom it?
Okay,
Yeah, thank you.
okay, sir.
Yeah, wonderful, doctor. Thank you.
Okay, okay. Thank you, sir. Today is the World International Diabetic Federation and World Health Organization create a World Diabetic Day in response to diabetic epidemic. Because today is the World Diabetic Day. Uh, 14 November is the birthday of Frederick Banting. It is one of the scientists of who discovered the insulin. So we celebrate the World Diabetic Day on 14 November. This is the symbol or logo of the diabetic day because it is positive symbol across the culture, and the culture symbolizes life and health. Why the blue? Because the color blue reflects the sky that united all nations. The blue border of the circle reflects the color of the sky and the flag of United Nations. The blue circle signifies the unity of global diabetic community in response to diabetic epidemic. Now we learn the anatomy of pancreas. Pancreas is the inverted J-shaped like structure, flesh-like structure, which is situated in the retro. It is a retroperitoneal organ, lie in the epigastric and left hypochondriac region. These are four parts: head, neck, body, and tails. Because Rajesh sir and madam are explain the management of diabetes in detail, so we learn the pathophysiology of diabetic mellitus. Diabetes mellitus, there are three types: type 1, type 2, and type 3. Type 1 is the insulin-dependent diabetes mellitus. In this insulin-dependent diabetes mellitus, there is a failure of produce the enough insulin, uh, and a die बीटा सेल तो पैंक्रियास से सीक्रेट बीटा सेल्स डाई हो जाती है, इसलिए इसको इंसुलिन डिपेंडेंट डायबिटीज मिलेटस कहते हैं और जुवेनाइल डायबिटीज भी इसको कहते हैं. सेकंड टाइप इज अ नॉन इंसुलिन डायबिटीज मिलेटस. नॉन इंसुलिन डायबिटीज मिलेटस इज अ इसमें क्या होता है, दिस इंसुलिन डिपेंडेंट नॉन इंसुलिन डायबिटीज मिलेटस, इसमें इंसुलिन रेजिस्टेंस की वजह से नॉन इंसुलिन डायबिटीज मेलाइटस होता है. इसमें जो अपने मेन टाइप 2 का डायबिटीज है वो कार्बोहाइड्रेट का मेटाबॉलिज्म का डिसीज में है, तो चर्बी जो फैट सेल रहते हैं उसका मेटाबॉलिज्म का डिसीज है. उसमें जो अपनी जो शरीर के अंदर की जो चर्बी रहती है उसमें से जो इंसुलिन एंड लेप्टिन नाम का जो हार्मोन रहता है उसके फंक्शन में डिस्ट्रक्ट होने की वजह से सेकंड टाइप का डायबिटीज के होने के चांसेस होते हैं. अपन जो फूड लेते हैं, फूड लेने के बाद उसमें से शुगर इंक्रीज होती है, जो भी खाना खाएंगे उसमें से शुगर इंक्रीज होएगा, लेकिन वो शुगर इज एब्सॉर्ब इन द ब्लड वेसल्स and it is distributed into the liver and muscle of the body cells, muscles of the body cell. अपन जो so and insulin is work as a just like a key and insulin receptor is work as a lock. जैसा आप बाहर गांव जाते हैं, बाहर गांव जाने की वजह से अपन घर को ताला लगा के जाते हैं, लेकिन जो आजू बाजू के पड़ोस के बच्चे रहते हैं वो लॉक के अंदर चिंगम डालते हैं. वो जब तक अपन चिंगम निकालते नहीं, यानी जो मसल्स के अंदर के जो चर्बी है, एक्स्ट्रा चर्बी है, जो निकालते नहीं, तब तक डायबिटीज से कवर नहीं हो सकता. जो मसल के अंदर जो चर्बी रहती है, जो फैट्स रहते हैं, उसको अपन इंट्रामायोसिलुलर लिपिड बोलते हैं, इंट्रामायोलिपिड सेल्यूलर. और जब तक ये निकलेगा नहीं तब तक सिक्रेशन डबल गुना 3 गुना ऐसा इंक्रीज होगा. और पैनक्रियास जो बीटा सेल्स है उसको ज्यादा वर्क करना पड़ेगा, इंसुलिन ज्यादा सीक्रेट करना पड़ेगा. और ऐसी एक स्टेप आ जाती है कि उनमें से पैनक्रियास एक थक जाता है और जो प्रॉपर इंसुलिन सीक्रेट नहीं कर पाता, इसके वजह से इंसुलिन रेजिस्टेंस हो जाता है. तो इंसुलिन रेजिस्टेंस होने का मेन अपन कैसा जान सकते हैं, जो लेप्टिन हार्मोन का रेजिस्टेंस अपन कैसा जान सकते हैं, तो उसमें से जो आदमी का एब्डोमेन बेली एब्डोमेन घेर जो 35 इंच के ऊपर ज्यादा हो, जिस आदमी को मीठा खाने की ज्यादा डिजायर होती है, उनको हाइपरथायराइडिज्म है, कोलेस्ट्रॉल है, पीसीओडी के प्रॉब्लम है, ऑस्टियोपोरोसिस है, इनमें जिनमें का आंसर हाँ होगा उनको समझ लेना चाहिए कि वो डायबिटीज 2 मेलाइटिस होने के चांसेस ज्यादा है. जिन लोगों को लगता है कि अपना डायबिटीज अपनी ब्लड शुगर लेवल नॉर्मल है, लेकिन फिर भी उनके ब्लड शुगर नॉर्मल आ रही है, लेकिन इनके शरीर में लिवर्स में जो 10% एक्टिव इंस्टेंट ग्लूकोज रहता है, जैसा अपन अपने पॉकेट में कुछ मनी रखते हैं इमरजेंसी के लिए, वैसा ग्लूकोज के अंदर 10% अपन ग्लूकोज रखते हैं. और बॉडी के जो मसल के अंदर जो 90% चर्बी रहती है या ग्लूकोज रहता है जो यूटिलाइज किया जाता है. जब अपना जो इंसुलिन का मेन फंक्शन क्या रहता है, जो ब्लड वेसल के अंदर जो ग्लूकोज रहता है, जो ग्लूकोज को सेल के अंदर एंटर करना, वो इंसुलिन का मेन फंक्शन है. जब ये इंसुलिन रिसेप्टर रेजिस्ट हो जाता है तब ये जो प्रॉपर ग्लूकोज ये सेल के अंदर पहुंच नहीं पाता, इसके वजह से जो ब्लड सेल के अंदर जो शुगर रहती है वो इंक्रीज हो जाती है. उस टर्म को बोलते हैं हाइपरग्लाइसीमिया. हाइपरग्लाइसीमिया इसका जो मेन कॉज है. तो और तीसरा टाइप अभी डायबिटिक 1 एंड डायबिटिक 2 वो कैसा सिग्निफाइड कर सकते हैं अपन. डायबिटिक फर्स्ट एंड उसके लिए एक फास्टिंग इंसुलिन नाम की एक टेस्ट रहती है, जो फास्टिंग इंसुलिन की लेवल 2.5 टू 25 इंटरनेशनल यूनिट पर ml इतनी उसकी नॉर्मल रेंज रहती है. जब समझ लेना चाहिए कि 2.5 इंटरनेशनल यूनिट पर ml का अपना फास्टिंग इंसुलिन रहा तो वो इंसुलिन डिपेंडेंट डायबिटीज मेलाइटस है. और जो 2.25 इंटरनेशनल यूनिट पर ml पर उसकी ज़्यादा वैल्यू रही, फास्टिंग इंसुलिन की वैल्यू ज़्यादा रही, तो उसको समझ लेना चाहिए कि वो नॉन इंसुलिन डायबिटीज मेलाइटस है. उनमें से इंसुलिन रेजिस्टेंस समझने के लिए भी एक जांच है, उसको एक फार्मूला है. तो उसमें से इंसुलिन रेजिस्टेंस का फार्मूला है, इंसुलिन रेजिस्टेंस इज इक्वल टू इंसुलिन इंटू फास्टिंग ग्लूकोज अपॉन 405। यानी जिस पर्सन का ग्लूकोज 130 mg पर DL है और उसका फास्टिंग इंसुलिन 4 है, तो उसका जो इंसुलिन रेजिस्टेंस है वो 130 इंटू 4 अपॉन 405 इज इक्वल टू 128। यानी वो प्री डायबिटिक कंडीशन में है। इसका मतलब है कि जो डाइट के ऊपर कंट्रोल आ सकता है। और जिसका उसकी नॉर्मल वैल्यू है 0.5 टू 1.5 ये इंसुलिन रेजिस्टेंस के लिए। और जो मॉडरेट रहेगा, मॉडरेट इंसुलिन रेजिस्टेंस, उसकी नॉर्मल वैल्यू है 1.5 टू 2.5। और जो सीवियर रेजिस्टेंस रहेगा इंसुलिन रेजिस्टेंस, उसकी वैल्यू रहती है 2.5 के ऊपर। यानी जिस आदमी का ब्लड शुगर लेवल 130 mg पर DL है और उसका फास्टिंग इंसुलिन 8 है, तो इंसुलिन रेजिस्टेंस इज इक्वल टू ग्लूकोज इंटू फास्टिंग इंसुलिन अपॉन 405। तो 130 इंटू 8 अपॉन 405 इज इक्वल टू 2.5। इसका मतलब है उसका वो सीवियर इंसुलिन रेजिस्टेंस है। तो ये मेन उसकी पैथोलॉजी डायबिटीज 2 की मेलाइटिस की है। तो उसमें जो फर्स्ट डायबिटिक है वो सडन हो सकता है, जो टाइप 2 है ग्रेजुअली हो सकता है। जो उसका ऑनसेट मोस्टली इन चिल्ड्रन एंड टाइप 2 इज मोस्टली इन एडल्ट्स, बॉडी साइज इन थिन एंड टाइप 2 में ओबेस पर्सन में होने के चांसेस ज़्यादा रहते हैं। तो साइन एंड सिम्टम्स, फर्स्ट पॉलीडिप्सिया, पॉलीपेरिया एंड पॉलीफेजिया। पॉलीयूरिया, जब ब्लड शुगर के ब्लड वेसल में शुगर ज़्यादा हो जाती है, तो ज़्यादा शुगर ज़्यादा होने की वजह से वो किडनी के थ्रू उसका फिल्ट्रेशन होता है। और फिल्ट्रेशन होने की वजह से जो ग्लूकोज रहती है वो यूरिन के द्वारा बाहर निकलती है, उसको बोलते हैं ग्लाइकोज यूरिया। और ग्लाइकोज यूरिया बढ़ने से वजह से जो ब्लड वॉल्यूम रहता है, जो अपना ब्लड वॉल्यूम होता है, ऑस्मोटिक प्रेशर इंक्रीज होता है। ऑस्मोटिक प्रेशर इंक्रीज होने की वजह से, डिहाइड्रेशन होने की वजह से प्यास ज़्यादा लगते हैं, उसको बोलते हैं पॉलीडिस्फेजिया। और पॉली पॉलीडिस्फेजिया हो गया। और पॉलीफेजिया, जब अपने बॉडी के अंदर जो रहते हैं कार्बोहाइड्रेट रहते हैं, जैसे अपने को बॉम्बे से दिल्ली जाने का रहा, तो अपन क्या करते हैं, CNG गैस डालते हैं और पेट्रोल भी डालते हैं। लेकिन उनमें से जब CNG का खत्म हुआ है तो अपन क्या करते हैं, वापस CNG का टॉपअप करते हैं, और जो पेट्रोल रहता है वैसा का वैसे ही रह जाता है। एंड जब अपने को CNG गैस खत्म हो गया कि अपनी बॉडी इंडिकेट करती है लिवर को कि कुछ खाना चाहिए, तब अपन क्या करते हैं, कार्बोहाइड्रेट का टॉप इंटेक करते हैं। और जो फैट सेल रहते हैं, फैट जो रहता है मसल में वैसा का वैसे ही रहता है, उससे क्या बढ़ता है, पॉलीफेजिया, यानी इंक्रीज द हंगर। दिस इज द मेन 3 सिम्टम्स ऑफ द डायबिटीज मेलाइटस। और एडिशनल सिम्टम्स है ब्लड विजन, हेडेक, फटीग, स्लो हीलिंग एंड कट्स, इची स्किन and complications, diabetic foot, diabetic cardiovascular disease, peripheral vascular disease, blood vessel disease, diabetic retinopathy, diabetic nephropathy, complications, diabetic foods हो गया। This is the pathophysiology. When the insulin plays a critical role in balancing glucose level in the body, it can inhibit the breakdown of glycogen or process of glucogenesis. It can stimulate and transport of glucose and fats and muscle cells. It can stimulate the storage of glucose in the form of glycogens. ये बताया पैथोफिजियोलॉजी। पैथोफिजियोलॉजी में क्या होता है, विशुद्ध जेस्टेशनल डायबिटीज mostly common in pregnant women. Also, complication in diabetes 2, periodontal changes seen in diabetes mellitus. These are the diagnosis. Fasting blood sugar, fasting plasma glucose level when the increase up to the are greater than the 126 mg per DL, and plasma glucose level और glucose tolerance test 75 ग्राम ग्लूकोज लेने के बावजूद भी अपनी शुगर 200 mg पर DL के ऊपर रही, और उसका HbA1c is greater than the 6.5. These are the diagnosis value for the diabetic 2 level. These are the normal value for the glucose, fasting PP and HbA1c. Normal value less than PP value less than 140, fasting glucose level less than 110 mg per dl, HbA1c less than the 6 level, and increase the value of this normal value is indicate that the diabetes mellitus. Management, good nutrition, regular exercise, diet control, and to maintain the blood pressure, meditation एंड आयुर्वेदा अप्रोच. जो आज अपन मधुमेह के ऊपर बात कर रहे हैं, तो अपने पुराने साल पहले, 1000 साल पहले अपने आचार्य ने प्रमेय का वर्णन किया है. त्रिदोष प्रक्रम निम्न विशंति प्रमा, यानी जो अपने बॉडी के अंदर जो 3 दोष रहते हैं, वात पित्त कफ, प्रमुख यानी जो कफ दोष का प्रभाव होता है, और दुष्य दुष्य जो 7 बताए जो बताई गई, रस, रक्त, मांस, मेद, अस्थि नहीं है उसमें, मज्जा और शुक्र, और वसा, जल, ओज और लसिका, यानी हेतु, दोष और दुस्सा, इनकी समूर्चना होके 20 प्रकार के प्रमेय होते हैं. जो मधुमेह है उनका जो 3 टाइप है प्रमेय के, वातज, पित्तज और कफज. कफज के 10 टाइप है, पित्तज के 6 टाइप है और वातज के 4 टाइप है. और वातज के 4 टाइप में से मधुमेह 1 टाइप है. और आप सिर्फ जो डिस्कस कर रहे हैं मधुमेह के ऊपर डिस्कस कर रहे हैं, जो 19 टाइप पता है उसके ऊपर ज्यादा मॉडर्न साइंस भी कॉन्सेंट्रेट कर नहीं रही है. लेकिन हजारों साल पहले अपन प्रमेय के 20 डिसीज के ऊपर पूरा डिटेल स्टडी हुआ है. उसका हेतु क्या है, उसका पूर्व रूप क्या है, उसकी संप्रप्ति कैसी है, उसके बारे में पूरा डिटेल स्टडी हो चुका है. जो प्रमेय के जो हेतु बताए गए हैं, आस्या सुखम, स्वप्न सुखम, दधानी, ग्राम्योदकानु, परसा, पयासी. आस्या सुखम यानी सुख का अतियोग होना. जैसा अपने को लगता है अभी सभी के पास व्हीकल हो चुका है. जो कुछ पैदल चल रहा है तो उसको पेट की छाया दिखी तो उसको लगता है कि वहां बैठ जाना है. वाल फिर बैठने के बाद लगता है कि अपने को लेटना चाहिए. उसके बाद लगता है कि कोई हवा हिलाना के लिए चाहिए. उसके बाद लगता है कि फैन चाहिए. उसके बाद लगता है कि एसी चाहिए. आश्चर्य सुखम, आश्चर्य सुखम ये जो अपन डिस्कस कर रहे हैं कि सभी सुख का अतियोग होना, ये सुख का अतियोग हो चुका है. दूसरा है स्वप्न सुखम, यानी सुख, स्वप्न के अंदर भी सुख देखना, यानी दिन भर गले के ऊपर बैठना और डबल से खाना. ऐसी आजकल आदमी की नीति हो चुकी है. दधानी, दधानी यानी दूध और दूध के प्रोडक्ट, दूध, दही, चीज, आइसक्रीम, ये दूध के प्रोडक्ट भी उन्होंने कॉन्ट्राइंडिकेट किए हैं. ग्राम्य दुकानी यानी जो जल जहाँ पानी का निचरा नहीं होता, दलदल रहता है, असंस्कारित जल, उससे डायबिटीज होने के चांसेस, प्रमेय होने के चांसेस रहते हैं. अनुप्रसा, अनुप्रस यानी जो पानी के अंदर जलचर प्राणी रहते हैं, मछली, खेकड़े, ऐसे अतियोग में खाने की वजह से प्रमेय होता है. पयासी, पयासी का मतलब है पय, पय का मतलब है जल और दूध. अतिरिक्त पानी जो पीना के आयुर्वेद से शास्त्र से बोला है कि जब प्यास लगती है तभी पानी पीना चाहिए, सूर्यास्त के पहले पानी पीना चाहिए. पानी का अतियोग होने की वजह से भी डायबिटीज होता है, क्योंकि उनकी वजह से किडनी के ऊपर क्लेद की निर्मित, क्लेद जो रहता है, जो प्रमेय का लक्षण बताया गया है, प्रभुत्व अविल मूत्रता, यानी जो बार बार मूत्रता होनी, और जो कैसा रहता है अविल, गठुड़ जैसा मूत्र रहता है, ऐसा प्रभुत्व अविल मूत्रता का लक्षण बताया गया है. तो ज्यादा दूध पीने से या ज्यादा पानी पीने से, असंस्कारित जल पीने से प्रमेय होता है. नवान्न पानम यानी जो नया पानी रहता है, गुड़ वैकृत, यानी गुड़ और उससे बनी हुई चीजें से खाने की वजह से भी मधु प्रमेय होता है. कफक रुचि, ये सब जो चीजें रहती है वो क्या बढ़ाता है, कफ और उसना क्लेद बढ़ाता है. उसकी संप्रप्ति में बताया है कि जो कफ, कफ का जो क्लेदक कफ, पाचक पित्त और समान वायु और व्यान वायु, उनकी दृष्टि होती है. उनकी दृष्टि होने से वजह से द्रव गुण की वृद्धि होती है. द्रव गुण बढ़ने से वजह से अग्निमांद्य होता है. अग्निमांद्य होने से धात्वाग्निमांद्य होता है, और धात्वाग्निमांद्य होने से क्लेद की निर्मित होती है. और क्लेद के जो ज्यादा क्लेद रहता है वो मूत्र के द्वारा बाहर निकलता है और मूत्र निर्मित ज्यादा होती है. और अपाचित धातु की वजह से, धातु शैथिल्य होने की वजह से प्रमेय होता है. ऐसा अपने आयुर्वेद में हजारों साल पहले पूरा उसका हेतु बताया गया है. उनमें से दिवा स्वप्न यानी दिन में सोना, आयुर्वेद के सिर्फ दिन में सोना कॉन्ट्राइंडिकेट है, क्योंकि उसमें सिर्फ ग्रीष्म ऋतु में वाम कुक्षी लेना बताया गया है. स्वप्न, व्यायाम, व्यायाम का अभाव, आलस्य, शीत, सिग्न, मधुर, मेध्य द्रव्यानी, ये द्रव्य सेवन करने की वजह से प्रमेय होता है. इसलिए अपने को लाइफस्टाइल मॉडिफाइड करनी चाहिए. ओके.
Just interrupting you in the middle.
ओके. ओके सर.
Please give us, a little bit faster time because we'll have to wrap it up. We are running out of time. Thank you.
ओके सर. ओके.
Please go ahead. Please go ahead.
ओके. 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 इसमें आयुर्वेद में बताया गया है पंचकर्मा, जो संशमन और संशोधन चिकित्सा बताई गई है. उनमें से जो कुश व्यक्ति है और दुर्बल व्यक्ति है, उनमें से संशमन चिकित्सा करनी चाहिए. और जो स्थौल्य है, बलवान है, उसमें से पंचकर्मा, लंघन, वमन वमन और विरेचन करना चाहिए, ऐसा आयुर्वेद में बताया गया है. ऐसा महर्षि आयुर्वेद का जो ग्लूकोमेक प्रोडक्ट है, वो भी मैं 5 साल से यूज कर रहा हूँ. उसमें से जो लोगों की पेशेंट के ऊपर मुझे फास्टिंग ब्लड शुगर और SbA1C1 की उसके रिजल्ट से दिखाई दिए हैं. तो उसके ऊपर ट्रायल भी हो चुके हैं ऑलरेडी, और मुझे जो पेशेंट के ऊपर भी उससे अच्छे रिजल्ट मिल चुके हैं. ओके. थैंक यू.
Thank you very much, Dr. Makanji and Dr. Samudeshri ji, for your wonderful presentation and giving us bits which we need to know in the present times about diabetes. So all great things there, and also taking out time of your busy schedules. So much. So thank you. And I would like to now invite few questions if you have the audience, so that we can go ahead further. Thank you.
Thank you, sir.
So we haven't received any questions as yet, but
No, sir,
please.
no any question right now.
Okay.
If there is any question in comment box further, we will
Yeah.
send to Sudhanshu ji.
Okay, please, yeah, please do. Thank you so much, and we would wrap up the session here for today. And we just keep discussing about diabetes in general. And as Ayurvedic doctors, we need to understand the prameha, madhumeha more. All with every patient, we should do that, and also educate the general public about where to intervene, and the intervention should be at the earliest. जितना जल्दी हम इसको रोकने का कोशिश करेंगे, इतना हम उनको एजुकेट करेंगे कि अपना खाना पीना बहुत इंपॉर्टेंट है. सिर्फ डायबिटीज ही नहीं, बहुत सारी ऐसे डिजीज हैं जिसका हम अग्निमांद्य से, जैसे डॉक्टर साहब भी बोल रहे थे अभी, मकान जी भी, की अग्निमांद्य ही है जो मेन हमारा प्रॉब्लम है. वो जनरल पब्लिक को ये बताना बहुत बहुत ज़रूरी है कि वो किस तरीके से राइट वे ऑफ ईटिंग ज़रूरी है, दिनचर्या दिनचर्या को फॉलो करते हुए. So,
Sir, right now we got a question from a patient. Just
okay.
I am displaying on screen.
Huh.
Please read.
Please.
Yeah.
Hello.
So this question is for Dr. Umakan. Please.
How to control the diabetes naturally? Yes, naturally, in first stage, when the insulin resistance in first stage, we control the diabetes in naturally. Absolutely, वो naturally अपन control कर सकते हैं. Lifestyle, meditations, food habits की वजह के अपन natural through और पंचकर्मा and Ayurvedic medicine, we control the diabetes naturally.
Thank you, Doctor, for answering this for us. So today we'll take the liberty of now wrapping up our session. Thank you so much for all those who have attended, and hopefully we have added to their knowledge and they take away something from this present session. And it's always available on other different mediums. If you could watch it on live, please do so. Thank you so much, everyone.
Thank you, sir.
Thank you.